Hi kids, I'm Dr. Dave. I'm a Burnaby family doctor and I grew up in Burnaby as well. I'm here to answer your questions about coronavirus, so thanks for sending in these questions. The first question is, where can I find credible sources about the pandemic and the coronavirus? That's a very good question because there's a lot of misinformation as well, especially on Facebook. So I would start with the Health Canada site, canada.ca. If you want local information, there's the BC Centre for Disease Control, bccdc.ca, and the World Health Organization, who.int. I especially like the frequently asked questions on the WHO site, but just make a note, internationally they say 1 meter apart for physical distancing. In North America, we're wanting 6 feet apart. Number 2, what are the most common symptoms? 3 of the most common symptoms are fever, a dry cough, and shortness of breath. But other symptoms could be a sore throat or difficulty swallowing, flu-like symptoms like muscle aches, chills, loss of appetite, and gastrointestinal symptoms like nausea, vomiting, or diarrhea. Some people get a loss of a sense of taste and loss of sense of smell. Now, when you look at these symptoms, even the most common, there's a lot of overlap with common things like the common cold and flu. So that brings us to the next question. What's the difference between the common flu, or what makes COVID-19 different from our common colds and the flus? Well, the common colds and flus are caused by different viruses. Many of them we've encountered before, so human beings have established some immunity to it. We also have shots for immunization for the seasonal flu shots. The common cold is a mild condition that gets better all by itself, but influenza could cause more serious disease in the elderly and in those with chronic conditions such as chronic lung disease and diabetes. The death rate from the regular flu that we see every season is about 0.1%. COVID-19, on the other hand, is caused by a virus we've never seen before. That's why they call it the novel coronavirus. We don't have any immunity to it. Although 80% of people will have fairly mild or moderate disease that don't require the hospital, up to 1 in 5 might have life-threatening conditions and sometimes require a ventilator. So far we're not sure, but the death rate seems to be as high as 3 or 4% of cases diagnosed with COVID-19. Question number 4, does the weather matter? That's a good question because a lot of people think that the flu and cold is related to colder temperatures and colder weather. But the reason we see more of those conditions in the colder weather is because we tend to congregate indoors. So it's not the temperature or the weather itself, but the fact that people are congregating close together and spreading infection more easily to one another. And that's why physical distancing makes a big difference. If we keep that distance from other people that may have an infection, we're less likely to acquire the infections and pass it on to others. Question number 5, how are death rates compared to the same time last year? Well, significantly higher. So far in Canada, over 4,000 people have died from COVID-19, and these people would not have otherwise died. Question number 6, does the virus affect just the lungs or other organs as well? That's a very good question. So the coronavirus not only affects the respiratory system, but also the circulatory system, including the heart, the kidneys, anywhere you have blood vessels, and even the nervous system. That's why it can be such a devastating condition in 1 in 5. How long does the virus stay in the air? Fortunately, not more than a few seconds. This virus seems to be passed through respiratory droplets. So that's mucus that's secreted when someone coughs or sneezes, or sometimes when they're talking as well. So if you're within that 6-foot distance from another person and they cough and sneeze, or say it and spray it, those secretions can get into your eyes, nose, or mouth and give you the infection as well. Also, if somebody coughs or sneezes onto their hands and then touches another object that you next touch, by touching those respiratory droplets while they still exist on that object, and then touching your eyes, nose, or mouth, then you can acquire the infection as well. This is why that physical distancing is so important. If you're far enough away from the other person, you won't be exposed to those respiratory droplets. And the other number 2 thing we can do is hand washing before you touch your eyes, nose, or mouth, or before you eat. So if you've touched an object that might have been contaminated by those respiratory droplets, by washing your hands thoroughly for at least 20 seconds and all sides of your fingers with soap and water. If you don't have soap and water, then use a hand sanitizer, about a toonie size dollop of the alcohol containing hand sanitizer, and then cleaning your hands appropriately before touching your eyes, nose, or mouth. Question number 8, how long does the virus last on surfaces? Well, it depends on the type of surface. So plastic and stainless steel, it can last up to 72 hours or 3 days. On cardboard, up to 1 day, but on copper, only about 4 hours. And just remember, any of these surfaces can be cleaned and disinfected. Next question. Can someone who's had the infection and recovered get the infection again? Probably not. Probably you will develop those antibodies. And the next question is, if someone has recovered from the virus, can those antibodies help other people? Well, that's being actively studied. So there's been some studies in different parts of the world where they've been giving people blood donations or antibodies derived from people that have recovered. So far we don't know how effective this is. The next few questions are all about masks, which is one of the most confusing areas for both kids as well as adults. And every country, every province and state is doing something slightly different. So the first is, how effective are masks that are not N95? So N95s are these really tight fitting masks. So they have to be sealed and tested to make sure they fit the individual. They're very uncomfortable to wear for a long time. So even us working in the hospital and the clinic are not wearing N95s all the time, but only when we're in certain situations with a COVID-19 patient where we might get a lot of secretions passed into the air. So the N95s are very effective in reducing the risk for myself getting infected, and definitely prevents me from passing on infection to other people. This is the standard surgical mask that we wear when we're doing operations in the hospital. It's a sterile field in the operating room, and it's designed not to prevent us from getting infections, but preventing us from passing on any germs or respiratory infections onto the patient. So these and the cloth masks that you might be wearing, like the one my daughter made for me, reduce the risk for you passing on infection to other people. Not 100%, but it is a good safe barrier to reduce the chance of passing on infection if you have it. It doesn't necessarily prevent you from acquiring infection from other people. That's why the physical distancing 6 feet apart is still really important, and hand washing is also very important as well. If everyone wore a cloth mask, we could probably greatly reduce the risk for passing infections on to each other. While we're on the subject of personal protection, I just wanted to say a few words about gloves. You see a lot of people in the businesses, essential services that are still open, including restaurants and other places where they will take your debit card or credit card with their glove. It kind of gives the illusion that they're clean, but if that business person is actually using that glove with everyone's card that they're touching, you have to assume that your card could be contaminated as well. So wearing gloves is not a substitute for careful hand washing. So what we do in the clinic and in the hospitals is we change gloves and clean our hands before and after every single patient encounter. The next question is the big question we all have. When will the COVID-19 lockdown be over? Well, the government just announced its plan, and I think it's a very wise plan to very carefully and slowly open things up, starting with the most essential services and setting up really precautions to protect the public, as well as individuals and people working in those businesses as well. And then our government will be carefully monitoring any increase in the spread of COVID-19, and it will be adjusted accordingly. So as it becomes more and more safe, ultimately we're waiting for a vaccine. We need a vaccine so that everyone will be protected, and then we could safely go about our regular lives again. Stay healthy physically and mentally. So that's an excellent question, because at the beginning the COVID shutdown, people were just reacting, doing what they were told to do, which is excellent, and that's why we've done so well in BC compared to other provinces and compared to other countries as well. But we're all kind of in a reactive mode. But now we're kind of looking at what we can do with this time, because it's going to be not quite normal for a long time. So I think we have to go from just surviving COVID-19 to thriving into this new world. So it's important to think about what I call the 4 foundations of self-care, looking after ourselves. So number 1 is healthy eating. to make sure we have a good food supply, eating lots of fresh fruits and vegetables and good sources of protein and healthy types of fats, and not skipping meals. So that's really essential. Number 2 is healthy physical activity. So even though we should be physically distanced from other people, the weather's great, actually, rain or shine, for getting out, going for a walk, going for a jog, going for a bike ride. We can still maintain our physical distancing and get that cardiovascular exercise and getting close to nature, which is what we all need. There's lots of activities you can do inside your house as well. You can do lots of stretching and body weight exercises. So there's lots of things we can do to improve our health, maybe even better than before, since we have a lot of free time compared to before. The third foundation of self-care is emotional well-being. Looking after your emotions, recognizing when you are getting really stressed out and knowing what you need to do. So in our public education lectures that I've had through the Burnaby Division of Family Practice, we talked about these key mental health practices that we should all look after and maintain. One is some type of reflective or meditative practice, knowing how to calm anxiety and calm our thoughts. The other is to be aware of our thoughts and knowing how to manage them, and recognizing that we can become more positive and more in charge of our life if we recognize those things that are under control and accepting the things that are temporarily out of our control. So what can you do to make a difference for yourself or people around you? What are things that you are still able to do in a positive way? And also looking at the positives, because we tend to have a negativity bias. That's how we've evolved. So we're always looking for danger, the things that are wrong. So we actually need in our brain to think of 5 positive things for every negative thing, just to come out neutral. And that's really important in getting along with the people that you are staying at home with, parents, your siblings, or roommates. It's easy to recognize the things that they're doing to get on your nerves or the negative thing about your situation. So every time you think of something negative, think about 5 positive things about that other person or the situation. And better yet, tell the other person, tell your mom or dad or your sibling or the person that you're living with the positive things that you appreciate in them. When we hear that we're appreciated, when we hear those thank yous, it makes us feel better and we start seeing more positives in our life. So that's one way that you can look at your thoughts and improve your mood and your sense of efficacy or making a difference in a positive way in your life. And the other, the fourth foundation of self-care is emotional and social well-being. So healthy relationships. So how you're connecting with other people, communicating in a positive way. So since we're locked down with people we love the most, even though we might be getting on our nerves, let's look at things that we can do things together and have positive interactions. And one of those things is complimenting one each other, doing things for one another, and expressing appreciation. And we all have a bucket list, what we want to accomplish sometime in our life, when we have enough time, when we're old enough, when we have enough money. My best friend's mom always wanted to go to Tahiti, but she never got a chance to go there. But come up with your post-COVID-19 bucket list. What are the things you would really love to do when you're done? And kind of visualize ourselves being there, because we will be there. Not tomorrow, maybe not next month, but think of the people that you want to connect with and to contact and to give a big hug to, the places you want to go. So make a list of your bucket list. And if it's people that you want to be with physically in the future, reach out to them now by telephone, your cell phone, or connecting them with online. Tell people that you're thinking about them and caring about them. So it'll give us something really positive to look forward to. And set your goals. So what are your goals for when we come out of the shutdown, when you're seeing all your friends again? What are the things that you're going to tell them that you learned? In what ways are we wiser? What are different things you've done, and how have you grown? And what are the different things that have happened and the positive things that people have done in your life since you started the shutdown? So come up with some goals and visualization of where you'd like to be at the end of this. And remember, we all are in this together. Although we're feeling isolated and alone, we all are working on this together, and together we're making a huge difference.